With school districts around the country grappling with how to reopen safely, many are missing a critical figure, a school nurse. Pre-pandemic estimates showed only 40% of schools in the U.S. have a full-time nurse. That shortage is now especially problematic when having a medical professional on campus is essential. Our senior medical correspondent, Dr. Tara Narula, shows us why many districts are now struggling.
I cover 20 schools, and it's difficult because we're spread pretty thin.
Across the country, school nurses like Nolly Hines call the situation dire, with many of them juggling multiple schools at a time. The CDC's national recommendation calls for one nurse for every 750 students, but most states fall short.
California's average is 1 to about 2,200 students, and our district, it's about 1 to about 3,700 students. So it's a big problem when we have 20 nurses serving 43,000 kids.
During a pandemic with still many unknowns, the importance of a school nurse on campus is more critical than ever.
We have over 75 kids who have diabetes, and we're doing management of kids with really severe medical problems like severe asthma, sickle cell anemia.
Nurses say part of their job now entails training school staff, like teachers and clerks, to handle medical emergencies, from asthma attacks and anaphylaxis to seizures.
It's unfair to put teachers and school staffs in that position.
Michael Mulgrew, the president of the United Federation of Teachers, says the shortage of nurses adds pressure on an already strained system.
What burden does this place upon teachers who are then expected to step into that role?
Well, that's been society's shame for quite some time now, that the teacher can handle everything. Of course, they will do everything in their power, but they're not medical professionals.
But for years, teachers have been filling the growing void. According to the National Association of School Nurses, 25% of schools in the U.S. have no nurse at all, and 35% only have a part-time nurse. This at a time when the nurses' responsibilities are expanding.
They have to make the medical judgment whether it's corona or whether it is something else. Then it's the isolation of whoever the individual is, then coordinating with the Department of Health to make sure that that person has access immediately to a COVID test. That all now goes to our nurse.
Lori Combe from the National Association of School Nurses says the issue all boils down to lack of funding.
77% of school nurse funding is from education dollars. And so their mandate is education, not necessarily health care.
She says they are pushing the federal government for $208 billion as part of the Safer Return to Schools coalition to provide the resources needed to make schools safe for opening.
As a parent, would you send your child to school this fall if that school did not have a nurse?
My community has a high rate of transmission, so probably not at this moment.
The pandemic also presents new obstacles like mental health issues, an area nurses routinely help students with, says Florida nurse Lisa Kern.
They are lifesavers from a physical standpoint and then from a counseling and mental health standpoint as well. They make a difference in the lives of children every day.
Reopening protocols vary greatly from district to district, but for schools working virtually, nurses are still working on case management for students who have chronic health conditions. They're also creating health plans for students in case of an infection. Many nurses say they are also using this time to adequately train school staff in infection control procedures and process.
Yeah, so important. Tara, we heard some of the nurses discuss the need to be in school for more reasons beyond the physical. What other things do they actually handle?
Well, Lori Combe in the piece said it really well to me. She said kids come to school carrying much more in their backpack than just their books and homework. And so the nurses are really able to identify the whole child, including any social needs, vulnerable children, and also to pick up on those emotional issues children may be having when they come in with a headache or stomach pain and it's really anxiety or depression. So they're really the sentinel on the front line.
Yeah, and there aren't enough of them, as you said. Tara, thank you very much.